Here in the studio, and I have Dr. Peter Capizzi with me. Good morning. How are you?
Good morning. How are you?
I'm fine, thank you. Okay, so it's miserable outside today. We're talking about snow.
Hard to believe.
Hard to believe, but there's no doubt that so many of us are thinking about bathing suit season because it's something we stress about, right? I mean, you must have people come into the office all the time worried about it.
All the time.
Yeah.
Yeah. We have a lot of people that come in, although most of us are not planners. They come in about 3 weeks before they're going somewhere and they want to arrange to have something done. But now is the time where people to start thinking about the spring.
Yeah, so there are things you say that we can do 3 months out, 2 months out, and 1 month out to kind of get us feeling better about our bodies in our bathing suits or in just our clothes or whatever. Let's start with a few months out. Let's start with April.
Sure.
And that's
April.
coming.
Yeah.
First you say weight loss programs.
Yeah.
That's always obviously the best way to do things.
That's correct. You know, if someone comes in, they're close to their ideal body weight, no matter what procedure we do, if we can get them down to their ideal body weight, it'll make them an excellent candidate as opposed to a good candidate.
So you're talking about not so much, we're not really going to be talking about liposuction or those kinds of things 3 months out. We're talking about, okay, you're close to where you want to be.
Correct.
Now we're going to get you to that last little bit.
A little fine tuning.
Okay, so fine tuning can for some people include breast augmentation.
That's correct. Yeah, and breast augmentation is the most common procedure in plastic surgery. And we use implants like this most commonly. These are the gummy bear, highly cohesive gel implant.
Yeah, I was saying to Dr. Capizzi in the break, like, this feels really good. It's really soft.
Yeah, a lot of people used to think that you could tell the difference between an implant and a breast, but this has something called the one breast feel, where it's very difficult to tell that, and when it's implanted, that which is the implant, which is the breast.
And this is silicone?
That's correct.
Oh, okay, all right. Gynecomastia surgery is on your list. What is that for people?
Male breasts or gynecomastia can be dealt with in a number of different ways today. It used to be just liposuction and excision. Now we have CoolSculpting, which that is a April kind of thing if you're thinking about June, because that takes, although it can be done in the office, not surgery, it takes a few months to kind of see the results. And then there's something called Kybella, which is a fat dissolving injection. And that also can be used to fine tune certain areas.
Yeah, and for guys, I mean, a lot of guys just won't take their shirts off at the beach because they're worried about it.
Right. And I also can't forget, weight loss is important for that too.
All right, let's talk 2 months out. We'll talk May, and we only have a minute left, so I kind of want to get through this pretty quickly. Cellulite treatments, of course.
Yeah.
Liposuction you can do. What's a drainless tummy tuck?
Okay, so tummy tuck without a drain. A lot of people think that when we do a tummy tuck, they have to have a drain. I would say 75% of mine have no drains anymore. We use glue, just like the crazy glue that we use on top of the skin. There's some that can go under the skin.
Okay, and 1 month out, June, if you're a really sweaty person, a lot of people, especially in the summer, get really sweaty. What is miraDry?
So miraDry is a energy delivered system. It's not a laser. It's not any type of like CoolSculpting kind of thing, and it's for the underarms, and it immediately works. So once it's treated, the underarms, for someone that's really excessively sweaty, that needs to bring like an extra t-shirt, it's fantastic. It works for that, so you don't have to use an antiperspirant, and it also does hair reduction in that area. So 3 things, the trifecta.
Does that last forever, or do you have
it
to get it?
lasts forever. Done. One and done.
Is it really expensive?
No.
I love that answer. All right, Dr. Capizzi, thank you so much.
You're
we always
welcome.
love it when you come to visit. This is fascinating. Where can people find more information quickly before we go?
CapizziMD.com.
There you go.